Welcome to Patient Best. We talk about big business. And today I want to tell you a story that really drives this point home. A friend of mine is a family practice physician. For 30 years he's practiced as a solo practitioner, which means he was the only doctor in his practice. His patients some of them were small children or babies when he started his practice, and they have grown up over the years, gone on to marry and had babies of their own. So not only does he know the grandparents, the parents, the aunts and uncles, brothers and sisters, he knows the whole family. It's a true family practice. A couple of years ago, the local hospital came to him and said, "We'd like to buy your practice." Well, he thought about it, and the more he thought about it, the more it sounded like a good deal. So he sold his practice to the hospital and went to work for them. Within a month, he realized his mistake. He said he had to see a patient every 10 minutes. But in his solo practice, if the patient needed him for 10 minutes or 60 minutes, it didn't matter. He was there for his patients. He could no longer do that. So every 10 minutes he was scheduled to see a patient, even though these were the patients he had known his whole professional life. Needless to say, after a year, he did not renew his contract and went back out on his own in what he knew best. You see, that's the true physician. The physicians today are under a lot of legal issues, time crunches, and pressures to see patients. And something else that this doctor told me about was that he had to chart more. And not only did he have to chart more, his income was no longer determined by him, but his income was determined by the hospital. And it was a salary plus bonus. What exactly is bonus? Well, if he ordered more EKGs, more x-rays, more MRIs, imaging studies, labs, he would get a bonus. So it was an incentive to order more, which meant more charting and more things put on the patient too. He just couldn't do it. So that's a glimpse into what big business does. So next time you're in your doctor's office, go ahead and appreciate him or her. Let them know that you understand the pressures they're under, especially if they're working for big business. Thanks, that's it for today. We're in your corner. Let the healing begin. We're going to fix this one patient at a time. Take care. Keep smiling. Patient Best.